And especially mass murder. Is that what we're saying
Absolutely.
here? An individual who might go out and kill one person might not necessarily turn the gun on himself and kill himself.
True.
But if you go out and kill multiple individuals, that the possibility is that you might kill yourself.
Absolutely.
Is that what we're saying in terms of suicide?
Absolutely. Adam Lanza, who killed several people at Sandy Hook Elementary School, he ended up taking his life as well. So there's this strong connection between murder and suicide. And I think that the connection is based on the fact that in the Middle Ages there was this belief that despair or madness has a lot to do with suicide. And I subscribe to that particular point of view. Let me just say that oftentimes people who are suicidal are in a condition of despair. And despair is really another term for rage. And often the motivation behind rage or despair is the wish to get revenge or to get even. And sometimes the urge to get even is an urge to get even with God. Sometimes the urge to get even is an urge to get even with someone of a particular ethnic group or a particular religious group. And sometimes the urge to get even is to get even with one's own self because one sees oneself as a failure. And so there's a lot of despair, unfortunately, in our world today.
And some of it leads to suicide, and those individuals who will go out and take a gun and go into a theater or whatever really have a real problem.
Absolutely. And now, in some cases, the despair or the rage and the wish to get even may also result in murder and, in some cases, suicide.
Very good. And of course, Dr. Poe, we're getting ready for our first commercial break, and I think that we have to say something about what happened in Nashville recently in terms of the killing that we had here with 4 people being killed. And so what we want to do is to warn our visitors that we are going to have you to make some statements in reference to this. And we're going to take a break, and we'll be back with our audience following this short commercial break. Are we clear? Okay. And so this is the second segment coming up, and so you just talk with them.
Okay.
This is your show. Run it through for me and take it on for me.
No problem.
Yes, sir.
Okay.
So when they say the bomb's ready, like unclip that, you have to pull that out, clip it back here, put it some further away from their mouth. So we're gonna put it down here. Kind of put it right there. That way his chin won't be hitting it anymore.
Okay.
All right.
Okay.
This is the second segment, right? Okay, we'll get out of here. Yeah, we'll be out of here before 3 o'clock. That's all I want to do is call. Because if I don't call her, you're going to be calling me at 3 o'clock. Time she get out,
What school is she at?
She's at Nashville School of Arts. Yeah.
Oh, in
Foster.
Is that right?
Yeah, she's over there. And scoring high over there, too.
Oh, is that
yeah, she's
right?
big time over there.
Yeah.
She's
a very gifted.
Yeah,
I have 2 of my grandchildren.
Thank you and welcome to the second segment of the show for today. We're talking to Dr. CPoe, and the topic is anatomy of suicide. Dr. Poe, let's see if we can pick up where we left off the last time and have you to continue.
Sure. The shooter several days ago, I think it was probably last Wednesday, I think that going into the Waffle House and killing 4 people, I think that's a suicide equivalent. I think that murder, in many cases, is a suicide equivalent. And I believe that if he had not been arrested a couple of days after, I think he would have ended his life. As a matter of fact, the Toronto, Canada, the guy who killed 10 people, okay, he, before he was arrested, he said to the police, shoot me, shoot me, shoot me, okay? And I think that that tells you that there is this strong connection between murder and suicide. So most people who commit murder, I believe murder is in many cases a suicide equivalent, or I believe that the person is covertly suicidal and is making an effort to end their life.
In his own life,
Yes.
even though he killed
Yes.
somebody else in reference to that.
Absolutely. And I think mass murders fall into that category, and many suicides as well. So I think that Travis Rainey would have ended up ending his own life. And so that's my.
He just happened
belief.
to have been caught before because he had a pistol
Yes,
with a backpack
yes.
and walking around in the woods with no clothes on and et cetera. And so that the only way you could get out of something like that is to
that's
be
true.
captured or kill yourself.
That's
And
true.
so I think that a large number of folks, including myself, thought that that would be what would happen to him before he was captured. But go on.
Yeah. And by the way, suicide is on the increase, especially among the middle-aged adult, okay? The suicide rate is usually about 3 times that of the homicide rate. Now, there is an increase in homicides, especially mass shootings. As you know, veterans who have been deployed overseas in Iraq or in Afghanistan are much more likely to take their own life by suicide. So I believe that there is this strong connection between murder and suicide, and I believe that people become suicidal before they become homicidal. And I think that homicide is often simply a manifestation
Of
that this person is in despair, this person is in a rage, and despair basically is feelings of hopelessness, helplessness, powerlessness, and oftentimes the rage causes the wish to harm other people and or the wish to harm oneself.
That's incredible, Dr. Poe. I mean, we rarely think in terms of that, but go on, speak to it.
Yes. Okay. So then the main thing I want to stress today is that oftentimes the core of suicide and homicide is despair, and that in a condition of despair, the person is in a rage, and often that's related to the wish to get even with God, with oneself, and or with another person. And so I think that that's why there's this strong connection between murder and suicide. Because most people, I believe, become suicidal before they become homicidal.
And so in a real sense, their suicide might be the results of either having committed or wishing to commit murder. Is that what we're saying?
Yes.
Is that the connection that you're talking about?
Yes. In other words, when we mistreat another person, the result is a kind of guilt. Okay, all right? And guilt involves the wish to harm or to punish oneself. Okay? And so I think that's why people who abuse children, people who abuse spouses, people who take advantage of other people, they have a problem, whether it's recognized or not, of unresolved guilt. And unresolved guilt means that I have the urge to harm myself, or I have an urge to interfere with my own growth.
Dr. Poe, as a psychologist, a psychiatrist, when you think in terms of suicide and you think in terms of your patients and et cetera, people that you deal with to give counsel or medical assistance to, are you able to, through just a conversation with them, determine whether or not they have reached that period of despair, that they are capable of committing suicide? I mean, is there any kind of warning that you might be able to give us in reference to how we might be able to recognize people who might be that far out in terms of their own despair?
Right. Well, now that's a very interesting question, very positive, good question. I think that despair in some cases will manifest itself in terms of delusions, that is, false beliefs. People want to harm me, people want to hurt me. I think in some cases as well, despair will manifest itself in terms of hearing voices, seeing things. In some cases, despair will manifest itself as bizarre behavior, unusual behavior. Maybe the person is cutting themselves, or maybe the person is an excessive drug user.
Or walking around naked.
Or walking around naked. Yes, absolutely, absolutely.
Yeah.
And I think that there's evidence that the Waffle House shooter was naked when he went into the store and ended up going home and getting some pants subsequently. So yes, bizarre behavior, flashing, okay, all of this is likely to be a manifestation of despair.
Despair. And so you would say that he was in a great state of despair when all of those things
absolutely, absolutely.
And that he might have really taken his own life, and that might have been the purpose of the gun that he had in his backpack. Would you make that sound?
Yes, I mean, there's a very likely possibility that this young man was going to take his own life.
We're going to take this final commercial break, and we'll be back with you following this break. Backpack and went on off walking in the woods naked and whatever and et cetera. What else could he do? You know, after having killed all those folks and then walking around with a pistol in his, they just happened to catch him, it appears, before he took it. Thank you and welcome back to the final segment of the show for today. We're talking to Dr. Cupid Poe, and the topic is the anatomy of a suicide. And of course, Dr. Poe, let's give you the last 10 minutes to simply inform our audience in terms of what they might know or what they might not know in reference to suicide and how they might be able to prevent somebody from taking their own lives.
Okay. As we said, oftentimes despair will manifest itself in various ways: hearing voices, seeing things, paranoid beliefs. Sometimes I believe that people who are suicidal are often non-believers. They may be atheists. And so I think there are many manifestations of persons who are in a state of or in a condition of despair. Also, I want to just repeat the fact that the suicide rate among middle-aged adults is on the increase. And it's interesting that Afro-American females have traditionally had a much lower suicide rate than the Caucasian population, than the but there's evidence now over the last 10 years that the suicide rate among Afro-American females are on the increase. Okay.
And as a manifestation of that, I was told just yesterday that one of my nieces had attempted suicide. My mother told me that.
Right?
And yeah, and so that go on, talk about
okay.
it. Yeah.
Okay. So you know, the man who burned this woman in I think it was in Lebanon. Okay, he was from Lebanon. There's evidence that he may have been suicidal, and ended up as a result of committing a murder. So there is this relationship between abusive behavior, taking advantage of other people, and unresolved guilt, which causes people to want to harm themselves, want to punish themselves. And sometimes addiction. We know that Robin Williams struggled with addiction, I think it was to alcohol and depression. And so oftentimes if a person has a drug problem, they are much more likely to try to harm themselves. They're much more likely to try they're much more likely to be suicidal. So, so those are very important, important facts. But I also want to stress again that the core of despair, I mean the core of suicide and homicide is despair, and despair is another word for rage, and rage is often related to the wish to get even, and that people are much more likely to be suicidal before before they become homicidal. And,
That's
and
extraordinary.
Despair and rage and the wish to get even is the basis of of both homicide as well as suicide.
And so as a society, we have to deal with, watch out for people who are in a state of despair
Absolutely.
or rage. We have to pay special attention to that because they can either kill themselves or somebody else. Is that what we're saying? That ought to be a red flag when,
Yes.
when that diagnosis is made.
Yes, yes. And so it's very important that we recognize some of the signs of despair and some of the signs of rage, because it does render people more likely to harm themselves, to harm others and or themselves. Now, the opioid epidemic, I mean, that's another sign, I think, of despair. When a person craves pleasure so much that they are willing to risk their own life, okay, in order to experience pleasure that comes with opioid use, whether heroin or morphine or whatever, then that person, I believe, is in a condition of despair. And unresolved depression may oftentimes end up causing a person to enter a condition of despair, unresolved depression.
Well, how would you, Dr. Poe, identify, and I'm looking for some signs, identify individuals that you might know and you say that if he has this or that, that he might be in a state of despair? What are some of the causes of despair?
Well, okay, unresolved addiction, okay? Addiction to alcohol, addiction to drugs, to opiates, okay? Unresolved addiction, persistent wife abuse, persistent child abuse. As a matter of fact, I believe that this married couple in Dixon, who killed their 5-year-old autistic child, it's possible that they're in a condition of despair because, you know, they have acknowledged, at least the father has, of beating the boy to death. Okay,
now that's a crime, isn't that something?
Yeah, I mean that's, and so I think that their condition may be a condition of despair. So in any event, as I think about the pictures that I've seen on television, I don't see any evidence of peace, any evidence of joy in their expression.
And so as a psychiatrist, you have to warn folks about despair. That's one of the because it appears to me that suicide or murder is about the worst that a person can commit, and so we ought to be always on the lookout for people who are in a grave situation in reference to despair. Would that be a correct statement?
Absolutely. And by the way, despair, violence is not something that just kind of jumps out at you. Usually the person has had violent fantasies over a period of time before the act of violence or self-violence.
I think the Nashville murderer had some kind of fixation with some of the country music stars. I think there were several that were mentioned in reference to his name, that he either loved them or had notes for them or thought of them or whatever.
When are you talking about Travis?
Yeah,
Remy?
yeah.
Okay. Well, he felt that Taylor Swift
Yeah,
was following him. Okay. All right. There's a syndrome called declaring boss syndrome, in which people feel that. They feel like they're in love with somebody who is famous. So this is the reverse of that. He felt that I think that Taylor Swift was out to get him or harassing him or following him.
And Dr. Poe, I tell you, you're just an extraordinary individual with so much information about the human condition and things that we rarely think of. But after you talk about them, it seems to make sense, you know, why folks would feel. Because if you want to kill somebody else, it's only the next step of wishing to kill yourself. Or if you wish to kill yourself,
Yes.
you wouldn't have any problems killing anybody else. We've got about a minute and a half, Dr. Poe.
Okay.
Last statement in
Okay.
reference
All
to
right.
that.
Well, it's to me it's understandable that if a person harms other people, that's going to lead to guilt, and that person is going to want to harm themselves eventually.
And so in a real sense, we ought to watch out, and we ought to try to deal with individuals who are in a state of despair. What would I do to try to deal with a person that I believe is in a state of despair?
Well, okay.
A minute.
Well, first of all, people who are bullies, okay? And I think your granddaughter has talked about bullying. I believe that this is the beginning of despair. And so I think that we need to do everything we can to reduce bullying in the public school system.
And that would be at least a step that
yes.
we might be able to do in order to correct a situation that could become
Yes.
either suicidal or
Yes.
Homicidal. Is that what we're saying?
And also trying to reduce gang activity. That also, I think, leads to despair.
Very good. And of course, let me thank you, Dr. Poe, and let me encourage our audience to tune in again next week for another informative edition of Comments. Thank you and good morning.